Welcome to this presentation on understanding your neck pulse. We'll explore why sometimes you might notice a strong pulsation in your neck and what that could mean for your health. Our goal is to help you understand when a visible neck pulse is normal, when it might be a sign to talk to your doctor, and what steps you can take for your overall heart and artery health. Let's start with the basics. The carotid arteries are major blood vessels located on both sides of your neck. Their crucial job is to carry oxygen-rich blood from your heart all the way up to your brain. What you might feel as a throbbing is simply the artery expanding and contracting with each heartbeat as blood moves through it. It's actually quite normal to feel your pulse here, especially if you gently touch the area or if you have a thin build. So, how do you know if what you're seeing or feeling is normal? A normal pulse in your neck is usually subtle, symmetrical on both sides, and simply follows your usual heartbeat. It might become a bit more noticeable during exercise or stress, but then it goes away. You shouldn't have any other symptoms with it. However, you should definitely talk to your doctor if the pulse is new or getting worse, if it's only on one side of your neck, or if you notice it changes significantly with your blood pressure. These signs suggest it's time for a medical checkup. Now, let's explore why your neck pulse might be visibly obvious. One category of causes involves issues directly within the artery itself, often on just one side of your neck. This could be an aneurysm, which is like a ballooning or weak spot that causes a noticeable throbbing. Or, it could be a dissection, a serious tear in the artery lining that requires immediate medical attention. Sometimes, an artery might just have unusual bends or twists, making the normal pulse more obvious. Less commonly, a rare, usually non-cancerous carotid body tumor might be the cause, presenting as a pulsatile lump in the neck. Another set of reasons for a prominent neck pulse comes from conditions that affect your entire body's circulation, creating what we call a bounding pulse. This can happen with a leaky heart valve, or if you have an overactive thyroid, which speeds up your whole system. Severe anemia, meaning a low red blood cell count, can also make your heart work harder. High blood pressure can contribute, especially by making any existing subtle issues more visible. Even heart failure, though often associated with visible neck veins, can sometimes cause a stronger arterial pulse as the heart tries to compensate. And, of course, intense anxiety, stress, or too many stimulants like caffeine can temporarily increase your heart's pumping force. Your personal observations are incredibly valuable for your doctor. For instance, if you notice the throbbing disappears when your blood pressure or heart rate decreases, perhaps after taking medication, that's a critical piece of information. This tells your doctor that the pulsation is very much tied to the forces within that specific artery. It suggests that there might be a subtle feature of that artery, like a slight bend or a bit of stiffness, that only becomes visibly prominent when the blood pressure and flow are at a higher level. This kind of detailed observation helps your doctor pinpoint the cause and order the most appropriate tests. It's crucial not to ignore a concerning neck pulse, as delaying a diagnosis can lead to serious health issues. The most feared risk is a stroke or mini-stroke, if blood clots break off from a damaged artery and travel to your brain. If the problem is related to your heart, it could lead to worsening heart failure. An aneurysm, if present, could potentially rupture. Depending on the cause, you might also experience worsening neurological symptoms like pain or numbness, or the underlying condition itself, such as uncontrolled high blood pressure, could progress and cause further harm to your body. Let's talk about what you can do to support your artery health. First, managing your blood pressure is key. This means taking any prescribed medications exactly as your doctor advises, limiting salt in your diet, and focusing on a heart-healthy eating plan rich in fruits, vegetables, and whole grains. If your doctor has given you medication to control your heart rate, it's important to stick to that regimen. And finally, work on improving your cholesterol levels through healthy eating and any medications your doctor recommends. Continuing our discussion on supporting your artery health, if you smoke, quitting is truly one of the best things you can do for your arteries. It's also vital to maintain a healthy weight, as extra pounds add strain to your heart and blood vessels. Aim for regular physical activity to strengthen your heart and improve blood flow. Don't forget the importance of managing stress, as chronic stress can impact your blood pressure. And if you have diabetes, diligently controlling your blood sugar is crucial to protect your blood vessels. These are all powerful, proactive steps you can take to protect your long-term health. When you visit your doctor about a visible neck pulse, they'll want to gather a complete picture. Expect them to ask you detailed questions about when you first noticed the throbbing, if it's on one side or both, and any other symptoms you're experiencing. They'll also perform a physical exam, which includes checking your blood pressure and heart rate, and listening to your heart and neck for any unusual sounds. They'll also carefully check to tell the difference between an artery pulse and a vein pulse. Based on all this information, your doctor will then discuss the next steps, including any necessary diagnostic tests. To get a clear diagnosis, your doctor may recommend certain tests. The most common first step is a carotid duplex ultrasound. This is a safe, non-invasive test that uses sound waves to create images of your arteries and show how blood is flowing. It can reveal issues like plaque buildup, narrow spots, kinks, or aneurysms. If more detail is needed, your doctor might order a CT angiography or Mr. Angiography for very detailed pictures of your blood vessels. Finally, blood tests can help check for underlying conditions like anemia, an overactive thyroid, high cholesterol, or even provide insights into your heart's function, such as with a BNP test for heart failure. While most concerning symptoms warrant a doctor's visit, some require immediate emergency help. Call 911 or your local emergency number right away if the neck throbbing is accompanied by sudden, severe pain in your head or neck, sudden weakness or numbness on one side of your body, difficulty speaking, or sudden vision changes. Also, seek immediate help if you experience sudden dizziness, confusion, trouble swallowing, new shortness of breath, or new swelling in your legs. These could be signs of a life-threatening emergency like a stroke. To summarize, a visibly throbbing neck pulse is your body's way of sending you a signal. It's not something to ignore. Remember that your detailed observations, especially how the pulse behaves with changes in your blood pressure and heart rate, are incredibly helpful for your healthcare team. Getting an early and accurate diagnosis, whether the cause is minor or more serious, is crucial for preventing complications like stroke or further heart problems. The most important takeaway is this: please don't hesitate to talk to your doctor if you notice this symptom. Your health matters, and taking this step is essential for your long-term well-being.